We next have Catherine Hughes. So Catherine is a passionate immunisation advocate and consumer representative based in WA. Fueled by the loss of her infant son Riley to whooping cough in 2015, Catherine's mission is to educate communities about the impact and prevention of vaccine preventable diseases. In 2016, she worked with other families affected by vaccine preventable disease to establish the Immunisation Foundation of Australia, which focuses on inspiring community-based immunisation advocacy. And through her foundation, Catherine works tirelessly to raise awareness, promote vaccination, and ensure that families have access to vital information. Catherine also works as a consumer investigator on a number of research programs and projects related to respiratory infections and immunisation. Welcome, Catherine.
Thank you. Thanks so much for inviting me to speak today. I'd like to begin by acknowledging that we are meeting today on Noongar Whadjuk Budja and pay my respects to elders past, present and emerging. So today I'll be sharing with you some insights into flu vaccine barriers for West Australian children. And this is based around the flu season that we've just had earlier this year. But first, just a little bit of background on who I am and why I'm here today. In 2015, I lost my son Riley to whooping cough before he was old enough to be vaccinated, and my husband and I established the Light for Riley campaign, where we did a lot of work to advocate for whooping cough immunisation and, importantly, pregnancy vaccination. It was really great to hear the linked data, and yeah, it just shows us, that work needs to be continued because we've got to lift those pregnancy vaccination rates. Through our advocacy work, we connected with a lot of other families around Western Australia and beyond who have been impacted by vaccine preventable diseases. And it's really with those families that we developed and established the Immunisation Foundation of Australia back in 2016. We are a patient advocacy organisation, so we're really passionate about ensuring that consumers and the community are really at the heart of all research, immunisation programs, policy decisions, etc. And yeah, our mission is to protect families and communities from vaccine preventable diseases via immunisation advocacy. We do operate nationally. We've had a few national campaigns this year. We launched the RSV Awareness Week back in June of this year. And thank you to many of the stakeholders who are here today who participated. And then just last week, we launched Australia's first whooping cough day, which was an exciting event. And you can access our resources and materials on our website if you wish to. So in August of this year, we became quite concerned at the low uptake of flu vaccines in kids under the age of 12. And we really, really wanted to know why. We wanted to get an immediate temperature check on the community and figure out what was going on, as soon as possible. Because we know that, it's important to inform all of our activities for the next flu season. So who did we ask? We spoke to our community advisory group members who went out into their communities and chatted with parents at the school pickup and neighbours and things like that. We asked parents on our Facebook page and also in online parenting groups. And the question that we asked was, did you get the flu vaccine for your children this year? And if you didn't, why not? The types of people that we asked, I have to say, are generally parents who are supportive of immunisation. So the themes that emerged from these conversations don't really reflect those who are just totally opposed to immunisation. And so we developed about 8 themes that emerged from our community conversations. And the first one, which was probably the most frequent theme that kept cropping up, was illness. Parents would tell us that their kids were unwell all throughout winter. It was really hard to get them vaccinated because their kids are so unwell with RSV and colds and things like that. And parents felt like they needed to wait for their children to recover. And I think there was sort of 2 reasons behind that. So first of all, they perhaps believed, correctly or incorrectly, that their child could not be vaccinated for flu because their child was sick and that it was a contraindication. Secondly, feelings of sympathy. So because their child was sick, why would they want to give their kid a needle that week? They'd wait till their child had recovered. We found that those whose children had already contracted flu earlier in the season, they generally didn't bother to vaccinate late in the season. And they certainly held the belief that if their child had already had flu, that they wouldn't get it again that season. Another theme that emerged more this year than in conversations with the community in previous years is needle phobia. So there were a number of parents who really were quite keen to get their children vaccinated for flu, but they just felt like they were unable to do so due to their child's needle phobia. And we sort of had comments like, this one just wasn't worth the battle. So obviously not prioritising flu vaccination either. But I think we definitely need to look at what support and resources and prevention we can have in the needle phobia space. And then cost of living came up as well. So some families found it difficult to pay for flu vaccines and associated GP appointments. I do note that with our online conversations, a lot of the feedback was national, so it's not entirely reflective of WA, but around 60% of the people that we spoke to were from Western Australia. We also noted that many parents said that they were busier than ever, that they were working more than ever, likely linked to cost of living and taking on increased work, which made it more challenging for them to access a GP. So timing was another issue that cropped up. So many parents spoke about just how busy they were, or that they'd forgotten about it, that they'd left it a little bit late. And a lot of them assumed that there wasn't much point getting the flu vaccine this late in the flu season. And this was in August. I think, I do wonder, we very strongly push, now is the time to get the flu vaccine at the beginning of the flu season. But are we accidentally pushing, now is not the time to get the flu vaccine by pushing that message so strongly? So we need to think about how we communicate timing with parents. And I think parents generally don't have a great knowledge of when the peak of flu season is. So when they're deciding, it's probably not worth it now, it might be, when the peak numbers are actually hitting. Access was an issue that cropped up. Some told us that their GP clinics didn't stock the flu vaccine, so they had to sort of pop out, get a prescription, pop out and come back. Several parents had access issues due to GPs being so heavily booked. And many parents expressed desire for pharmacist vaccination for school-aged children, which was interesting because in WA, of course, we had pharmacy vaccination for kids aged 5+, which is, something I found really, really convenient. I'd complained in previous years about the challenges of having kids at school and trying to get them vaccinated, and the nurses working 9 to 3:30, and yeah. So I think it was interesting, that lack of awareness that pharmacy vaccination is possible. And then we had some comments about mandate removal as well. So several parents mentioned that the removal of mandates for aged care visitors meant that their child no longer needed a flu vaccine to visit their grandparents in aged care. I think that we need to carefully monitor and measure, the impact of adding in mandates, of course, but also like the impact of removing mandates and what message that sends to the community is quite relevant too. So 2 more themes emerged. Distrust. So a number of parents highlighted that COVID brought on a distrust of the medical community, and it made them more cautious about their vaccine choices. Anecdotally, it seems like a lot of that came from older men more than women, but that's just an anecdote. And then perception. So some parents mentioned that flu vaccines are not a regular vaccine, a standard vaccine, or a normal vaccine, and that it's not as important or not as necessary as what they define as routine childhood vaccines. I would hazard a guess that if you got parents to list vaccines in order of, most important to least, I think flu vaccine would be right down the bottom, unfortunately. We had a couple of comments from parents who said that they put their children in daycare, the kids are a bit older now, but that lack of a flu vaccine mandate in the childcare setting gave them the impression that it's not as important. So we have to think about how the impact of the childcare centre mandates and not having flu vaccine mandated, maybe for practical reasons, does that send a message to parents that vaccine is less important? Or does that message kind of stick with parents right throughout their child's life? A little comment here from one of the parents that I've just quoted. This comment really sums up a lot of the feedback that we had. This year has just been insanely busy and endless sick kids. And unfortunately, it's just been something that has fallen through the cracks. Interestingly, this year, compared to previous years when we've gone out into the community and chatted about flu vaccination, we didn't see safety concerns brought up by parents. And that was really interesting because every other year they've brought up, that there's been safety issues in the past with the flu vaccine. Maybe that's starting to fade in people's minds as we get, different parents coming through. But that was just an interesting note that we didn't hear much chatter about safety. There are some areas of opportunity for our 2024 flu season and beyond. I think we need to look at the way that we communicate with parents what to do if their child is sick and it's flu season and it's time to go get vaccinated. I don't think they really understand about illness contraindications, and so we can do some work there. I am concerned about needle phobia. I really do feel like this is a growing issue as we're perhaps seeing more anxiety in children. It seems to go hand in hand to a certain degree with needle phobia. So we need to think, first of all, how can we prevent needle phobia? And for those kids and families, who are needle phobic, how can we provide appropriate access to flu vaccines for needle phobic children? What resources can we provide? I think we can do more to promote pharmacist vaccination for kids under 5, like I mentioned before, over 5, sorry. I think many families are not aware, although I will note there was great awareness of the free flu program. I think it was in June and July from memory. So that came up a lot, that it was free in WA, so that was great and obviously well promoted. I think it's important to provide more accessible locations for children's flu vaccinations. We've got, dental clinics at school to ensure that dental health is accessible for children. We could have little medical clinics, flu vaccine clinics, mobile vaccine clinics centred around schools, because that's where parents are. It's easy to get, multiple children vaccinated without too much fuss. And of course, like I mentioned before, the perception problems with flu vaccines, they are perceived differently in the community by parents, and we need to address this. And just finally, I thought I'd just share some thoughts about how we communicate flu vaccine to WA families. If you are involved in any communications, there's a few important things to remember. Provide details about access to flu vaccines, provide a really clear recommendation, because we all know recommendation is like the most important thing to motivate someone to have a vaccine. Have your resources reviewed by community members where possible to ensure that they're easier to understand and appealing and relevant. Reinforce the social norm of flu vaccination for children, that it is a normal, healthy thing to do for kids. And I think importantly, we need to look at the timing of our flu vaccine campaigns. And sometimes I feel like they're timed to suit, to suit us and health departments and the people who supply the vaccine, to suit the hospitals. But we also need to think about what suits families when receiving communications. So having campaigns like a Before the Bugs campaign early in before their kids are getting the winter illnesses, to maximise flu vaccines. Having back to school campaigns, so understanding that parents potentially have more free time in the school holidays, and children certainly have more free time in the school holidays. They're going to have greater access to healthcare in the school holidays, so really capitalising on the school holidays. And then communications about, not being too late in August to remind parents who have been sick and have been busy and have procrastinated for whatever reason, that flu vaccines at this point of the year are still available and that they're also still worthwhile. Thank you very much. I'm happy to take questions now or later.
Does anyone have any questions for Catherine?
Thanks, Kath. That was really interesting. More of a comment, but I really liked your idea about the clinics at different locations. And if they were in the school holidays, like you said, it not only makes them accessible and when people are available, but also normalises it because it becomes something that is offered at that community level. So I thought that was a great idea.
Yeah, even sort of school holiday community activities, exciting, fun things to lure the children there, the families there. And then you have the flu vaccine pop-up clinic, at the same event would be very tempting for me to take my kids there for sure.
Just with your work, about needle phobia in kids and the fact that true needle phobia in children is probably not the norm. It's more just that conversation with parents. Do you guys work much with parents or have information about how parents can have conversations with their kids, positive attitudes towards immunisation appointments, and really starting from when they're little, and how you have those conversations with your kids and families in general? Do you guys do at all work with that with consumers?
Yeah, so at the moment,
Just repeat the question.
yeah, sure.
Just for those on Teams, I'll just repeat the question. So it was around conversations to families around needle phobia with their children.
So understanding that this is an issue that we really want to address, we've been just starting to collaborate with a nurse over East, Lauren Barber, who runs Needle Calm, and she's been providing us lots of resources, and then we're working with a few others. So we're sort of developing resources at the moment to support needle phobic families and individuals. Currently, I think, one thing that we've done in the past and one thing that we can provide are educational resources for children, which help alleviate some concerns. I think they do some work at preventing needle phobia if the child really understands the purpose of why they're being vaccinated. So if you go on our website, you can order our Beat the Bugs books, which can be used to distribute to children, and hopefully, by educating, it will help prevent some needle phobia and needle anxiety. Thanks.
Thanks, Catherine. Wonderful work as always. Just picking up on that comment, do you think this is something, now we're aiming at school age vaccination more, that we should incorporate in the curriculum? You could imagine you could have the Beat the Bugs class health promotion message just before the school holidays in March or early April.
Yeah, I definitely think it should be part of the school curriculum. Certainly, at that sort of, when we've got the school-based immunisation program, year 7, year 10, there's opportunities for not just preventing needle phobia, providing important science and health education, but also potentially it could have the impact 10 years down the track. We might see less vaccine hesitancy as they're, having children, maybe 20 years down the track. But yeah, so I think, look, there's a lot of merits for that, and it's something I'd really love to see in WA and nationally.
So obviously you spoke about a bit about needle phobia and parents having conversations with their children, and you've been speaking to Needle Calm. Was there any conversations with any of the parents that kind of talked about, is there enough appropriate immunisation clinics or GP practices that have awareness around sensory needs and things like that? Because I've spoken to parents before where they've said, their GP just won't vaccinate their child because they're just too hard to vaccinate. And that's...
We haven't had the feedback so much that the GP won't vaccinate their child. It's more that their child won't be vaccinated is the way that parents are framing it. They're really not saying it's the GP, they're saying it's the child. Recently, I had one mum reach out to me, I think last week, saying that she managed to get in at PCH, and I think her child will be sedated, but that was like I think she wanted to do it for flu vaccine, and this was last week she got in. So there's obviously a lot of effort and time on the parents' part to be able to access the resources that they need. So we need to look at how we can, quickly and, in a time appropriate way, get children vaccinated for flu, because obviously timing is important. Yeah, thanks.
Yeah.
Hi, it was just a comment. In terms of needle phobia, how far away are we at getting a flu vaccine delivered through a different mode, especially for the younger children?
That's a great question for someone else. But a very good question. Peter, I don't know.
Peter.
Look, I think unfortunately the nasal flu vaccines that have been used in Europe we don't quite understand, have not been as effective as they originally were when they were released. So I think that's probably meant that we're unlikely, and we've never had it in the Southern Hemisphere. So there are other approaches in terms of intradermal vaccines and needleless. So, but they're still, I think, we haven't been able to make a vaccine that's been as effective as the current ones that we give intramuscularly. But I think that may well come. So I think, and there's some really good work being done in that space, but it's more a 5 to 10 year issue rather than around the corner.
Thank you.